All right, so those who have just joined us, thank you all for joining us for our first health insurance town hall. My name is Zack Goss. I work for the Vermont Department of Vermont Health Access within the Health Access Enrollment and Eligibility Unit within that department. And today we're going to be talking about the American Rescue Plan Act and a lot of new changes and that may benefit many customers who get insurance through Vermont Health Connect. My role at the department is to communicate to the public and with stakeholders around Vermont. And so one of the things that I'm really excited about doing this summer is kicking off this town hall series where we hope to engage with the public and get you the information that you need to help you make decisions about your health insurance. Couple housekeeping issues. We do have our team working behind the scenes, so thank you to the whole team working behind the scenes to help with the tech today. This is a new venue for us, but we're excited to try it out and hope that you enjoy it too. You can post questions in the Q&A box located in your Teams application if you're on the computer. We will try and get to all the questions posted in the chat or in the Q&A by the end of today's hour-long town meeting. In the event that we can't answer all your questions, we will make answers available either online or at a later town hall meeting. Again, this is one of 6 town hall meetings. We plan to have 5 more after today throughout the summer and probably into the fall. Without further ado, I am going to introduce Sheehan, who is with us also from the Department of Vermont Health Access. And Sean, welcome and thanks for coming on and joining us for this town hall. Maybe you can start by sharing a little bit about what we're going to talk about today.
Great. Yeah, thanks, Zach. I'm excited to do these town halls to reach out to Vermonters, and I'm really excited about what the American Rescue Plan means for Vermonters who get their insurance, who buy their insurance on their own with their family through the state's health insurance marketplace, which is Vermont Health Connect. Department of Vermont Health Access runs our state's health insurance marketplace. And for the last several years, we've been helping people access this health insurance plans through Blue Cross and through MVP, using financial help from the federal government and from the state. And in the past, it's often been a kind of a tough decision. People have had to decide: do I take a plan that has a lower premium and higher out-of-pocket costs? Or do I pay maybe more than I can afford in the premium to have lower out-of-pocket costs? And really, with the American Rescue Plan, it's really changing that dynamic, changing a lot of the narratives. So we really want to help people get the word out if they haven't checked what health insurance costs, various plans to do so if they don't have insurance. But really, for this first town hall, I'm giving probably a little bit of foreshadowing what we're going to do in the upcoming town halls. And in this one, we really wanted to be focused on Vermont Health Connect members who should have gotten a notice in the mail last month, letting them know about the increased financial help and their opportunity to change plans. And we want to let them know what they can do to save the most money, and of course to help get the word out to other people who might not have insurance. On that side, wanted to start by saying what we're not going to cover today. Usually when we do presentations, we talk a lot about health insurance literacy, a lot of health insurance terms, what deductibles are, what out-of-pocket costs are. Because we're hearing this first meeting, particularly for people who already have insurance. We're not going through that. We're not going to be talking as much about essential health benefits. Essential health benefits being the 10 types of benefits, everything from emergency care to hospital services, and a whole other list of types of care that all health plans under the Affordable Care Act are covered. Again, we're not going to be going through that. That's really important for people to know if they're trying to decide whether to get insurance or not. But because all plans cover all of those services, we're not going to get into them for our current members. And then we're also not going to get into the process of choosing a health insurance company. I want to make that distinction between, when we talk about health plans, we talk about all the different types of metal levels that we will be talking about different plan designs that we will be talking about, and also, but by the different health insurance companies. We usually would have representatives from Blue Cross and from MVP on, as we do during these events in open enrollment. The reason we're not right now is because when you change plans mid-year, as we'll talk about, anything you've already paid toward your deductible will carry over and be applied to your new plan, as long as you choose a plan with the same insurance company. If you change to a different insurance company, what you've paid toward the deductible won't carry over. Therefore, we're operating under the assumption that most people who are current members, at least for this mid-year change, will be looking to change to a different plan design with their same insurance company. So we won't be talking as much about the choosing between insurance companies here. To talk about what we will cover, we'll talk about how members can use the new financial help. We'll talk about how you may be able to save money by changing plans, as we referenced. And as I said, we'll talk about a new educational toolkit we have to help get the word out through social media, articles, newsletters, things that your organization or neighborhood front porch forum, things like that. So those are all the things we will be talking about. And I think to jump right in. Where should we go, Zach?
Yeah. Thanks, Sean. That's really helpful. And I think that you kind of answered this first question that we have from someone. They said, I was listening to the Red Sox game on WDEV and heard about lower insurance through the Health Connector, which is Massachusetts health exchange. Is that something Vermonters can get as well? And just to confirm, Sean, that is exactly what you're talking about. Is that right?
Yeah, that's exactly right. So I think to back up, the American Rescue Plan that was passed by Congress this March was a federal bill, gave a lot more financial help to people when they buy insurance through health insurance marketplaces. And there's a different health insurance marketplace in every state. Some states use the federal marketplace. Other states, like both Massachusetts and Vermont, have state-based marketplaces. So yeah, Zach, as that person references, and I listen to the Red Sox too, and I've heard a lot of ads for the health connector, talking about how people can get lower health insurance costs now this summer. I think they have those ads here earlier deadline. I think people have to sign up by maybe middle of July in Massachusetts. Our special enrollment period for people that don't have insurance in Vermont goes until October 1st, so people have a little bit more time. But the sooner you sign up, the sooner your health insurance can start, the sooner you'll be taking advantage of those financial savings. And for people that we're really talking about today, having the opportunity to change plans, that differs a little bit from state to state as well, whether people are offered a chance to change plans or only under certain circumstances. Here in Vermont, everybody who signs up through the marketplace has the opportunity to change plans. So if people are directly enrolled with their insurance carrier, they can move over to Vermont Health Connect, transfer their plan, their deductible will carry over, they'll be in the same plan. And then once they move over, they'll have until August 15th to change to a different metal level and plan design if they want, just like current members do as well.
Right. Got it. So it sounds like, you know, whether you hear it locally or in another state, this new information in the American Rescue Plan Act is relevant to you, but how that applies specifically to your situation is going to be, it's going to be important for you to look to where you get your health insurance. So if you're a Vermonter, that would likely be Vermont Health Connect if you get it through the exchange.
Yeah, that's right, and that's a good, I think, point too. That really where you are, it's where you are a resident. So if you're a resident of Vermont, you don't have, you can't sign up for Massachusetts health insurance through the connector. You sign up through our marketplace, which is Vermont Health Connect. And if you call the federal marketplace, they'll give you the number and website address for Vermont Health Connect.
Got it. Okay, so just diving in a little bit. So if I or someone I know is interested in how I can get this financial help that is now available, how do I know that I'm a candidate for this or that I'm eligible for it, and where do I even start?
Yeah, absolutely. And I think the screen sharing here, the website for everyone who's a current member, they should have gotten a notice back in June, last month, mid to late June, and the notice would have been several pages long. But the first page should have looked like this, letting you know that number one, you may get more help paying health insurance bills. Number two, you have that opportunity to change plans by August 15th. And this first table is important. An example here that we're looking at is somebody, I think a couple, so a two-person household in a couple plan that had an income of about $35,500. Before the American Rescue Plan passed, they would have qualified for $1,139 in premium tax credit. And they also, because their income is less than 3 times the federal poverty limit, they also get additional Vermont premium assistance, $44 they can apply to lower the cost of whichever metal level plan they choose. After the American Rescue Plan and the implementation that went into effect in the system in June, they now qualify for $1,272 per month with that same income. So how they go about applying it is a couple ways they can get that those lower costs. And what we'll show here is on the website. There's a lot of great information on the website. In today's town hall, we're really just going to focus on 3 links from the homepage. 1, that login link. 2, the plan comparison tool we'll talk about in a little bit. And then 3rd, you'll see right up at the top, there's learn how the American Rescue Plan lowers health insurance costs for Vermonters. And so if you want to apply those lower costs, you can click on that login button. And if you have an online account, you can sign in and go to change how your financial help is applied. If you don't have an online account, you can set one up. You can also call the customer support center. The phone number is in those notices and on the website as well. But really, I think from this page here, you'll see that there's really three broad options of how you can get your premium tax credit. And it's the same way as you get the premium tax credit every year, but now it's just different because there's more money added mid-year. The first thing you'll see is where it goes to all. You'll notice that $1,458 that this couple could apply per month. You'll notice that that's greater than the amount of that premium tax credit we were just looking at. And the reason is you get that amount for you get this amount, the $1,272 for the whole 12 months if you have insurance for the whole 12 months. But because you were only taking that $1,139 for the first 7 months of the year, you now have all that extra money to apply. So if you want to apply it over the last 5 months of the year, which you can do as long as you request this change by the end of next week, by July 15th, it'll be effective on your August bill. This couple would be able to apply up to $1,458. And what that effectively means is, depending on what health plan they're in, if their premium costs less than $1,458, they could have zero premium for the last 5 months of the year. Alternatively, some households, not many, but some choose to take no premium tax credit in advance to pay their full monthly premium every month, knowing that when they then do their taxes next winter, they'll get a large tax refund back, everything that they would have gotten in their premium tax credit. And then finally, the middle box is some people might choose to take, say, you could type in $1,100. You can type in any amount you want here. You could do $1,000. You could do $1,200. Whatever you want to reduce your bill by, knowing that the difference between the amount you have in here and the amount the all would be is what you would get back in a tax refund when you file your taxes. And the reason you might do that is if you're not sure of what your income is, if you think your income might be higher, you want to be sure to get a tax refund and not owe. Some people choose a little bit lower here. So this is the way you go about doing it on the website. And again, if you prefer, you can call in and make the same request.
So there's a lot of potential savings on the table, and it also sounds like there's a couple things to consider when you're making this change in terms of whether you want to take this money and apply it to your monthly payments, or if you want to get that all back at tax reconciliation time next April or before. Is my understanding correct, Sean?
Yeah, that's exactly right. And I think kind of a good analogy to think about is, if your job has you fill out, the federal tax form for the amount of exemptions you want to claim, and you have the option of how many exemptions to claim, knowing that is going to result in your weekly paycheck or your biweekly paycheck being larger or smaller depending on what you choose, knowing that if more money is withheld for taxes, you'll be more likely to get a refund or not owe money when you file your taxes. This is the same thing. It's just the reverse. This is a tax credit you're getting if you want to get it all up front, knowing that even if your income turns out to be higher, you might owe a little bit of money, but you'd rather have the money sooner rather than later. You can choose that all. If you'd rather be sure you're not going to owe taxes, you can you can dial that back a little bit.
Got it. So it sounds like well, actually, let me pose this question. If I don't call in, or if I don't make this change online, rather, will I be guaranteed that extra money, or do I have to do something in order to get it one way or the other?
Yeah, you don't have to do anything, other than file your taxes, and I think all of the normal rules apply. That have always been the case with the marketplaces. If you're filing taxes, if you're taking tax credits and you're married, you have to file jointly. All those same rules apply. But no, if you don't do anything, you'll continue to get the same premium tax credit as an advance payment, the same as you've been getting for the first 7 months of the year. If you've been taking $1,000 a month in advance, and you got a notice saying you now qualify for $1,100, and if you go online, you can see you'd have the option to take even more. You'll still, but you don't do anything, then you'll get the $1,000 in advance for the rest of the year, your net premium will be the same as it's been since the beginning of the year. But then when you file your taxes and your income turns out to be about what you expected it to be, you'll have a significantly larger refund. You'll get the same amount of tax credit regardless of what you choose here.
Got it. Thank you. And I just want to remind folks, if you are just joining us, or if you've been joining us the whole time, feel free to post your questions in the question and answer, the Q&A box, and we will get to those during this town hall. Don't worry about the timing of it. Just post away, and we will get those over to Sean. Sean, so you mentioned this kind of one situation, and I'm wondering how this this applies to other family or household sizes, right? So obviously there are Vermont Health Connect customers who are individuals, and then we have families who may have many family members. So can you speak to that a little bit?
Sure. Yeah, I'd be happy to. And I think, I know some people love graphs, and other people hate graphs. So I'm just going to show one graph today, and I appreciate those who don't like graphs bearing with me for the one. And I think if we have right here, like I said, promise the only graph we'll show today shows that what an individual Vermonter would pay for the second lowest cost silver plan by income. So this is one person on the bottom. You can see what their income is, their 2021 income, and then as a percentage of the federal poverty level, what that is. And the blue line shows what people would have had to pay for their net premium after the financial help they got before the American Rescue Plan passed. And you'll see that people below this line here, that where it goes straight up, that's 400% of the federal poverty level. So that's an individual earning about $51,000. If you earned $51,000, you would could get that second lowest cost plan for just over $400. If you earned a few dollars more, you'd be paying about $260 more, about $670. So quite a big jump. And one of the great things about the American Rescue Plan is it got rid of that cliff, and people were really worried about if they take that premium tax credit, will they have to pay it back if they don't know exactly how much they're going to make. Fortunately, that same risk isn't there anymore. And it also means that people who are earning more than that amount, even if they're earning 4 times, 5 times, 6 times, 7 times the federal poverty level, up to over $90,000, they can still get some premium tax credits. And in fact, for people who are couples or in a family plan, it's much higher. In a family plan, you could have a household income of $250,000, and you'd still get some premium tax credits. So this is a big deal. It means a lot more financial help for a lot more people, and it also means down here for people who already were getting financial help, that they can get a lot more. And so we take the example of an individual earning $25,000. Before the American Rescue Plan, it would have cost them about $100 per month for this silver plan. Now they can get that silver plan for $7 a month, and that's a really big deal, because when we talk about plan selection and the metal levels, people who can get into a silver plan whose income is less than 2 times the federal poverty level get very low out-of-pocket costs with a silver plan. So whereas before they had to decide, I could get a bronze plan with high out-of-pocket costs for close to zero per month, or I could pay $100 per month, but with this income, $100 per month is is a lot, and that's a tough choice for people to make. Fortunately, now with the American Rescue Plan, it's a somewhat easier choice for many people to get into a plan that will work better for them with lower out-of-pocket costs, and also have a lower premium.
Wow, so there's really benefits across the board for folks, which I think is really exciting news. And I just want to shift over to our Q&A. That we had a clarifying question about just wanting to understand what you said. Vermonters who are already registered with Vermont Health Connect will receive more money in their tax returns this upcoming year, even if they don't fill out this form by August 15th. And I think probably by form, this person is referring to the application or making this change online or making the call, because I don't believe that there's a specific form that we'd need to submit. Is there, Sean?
No, there's no form, and maybe they're referring to the web page we just showed, where people can log in and use that, write that form to choose how much of their financial help they want to take in advance, how much of the premium tax credit they want to take in advance. I don't know that for sure, but you're right. There's no form they have to fill out. They can make that selection if they want to take their additional premium tax credit as a discount on their monthly bill. They can do it as we showed, logging into the website, or by calling. But I think two pieces to clarify there were one, you're absolutely right. They don't have to do anything by August 15th or any other date in order to get more premium tax credit. If they don't do anything now, they'll pay the same net bill for the rest of the year, and they'll get the larger premium tax credit when they file their taxes. Number one. Number two, the August 15th actually isn't a date that relates to how people want to apply their financial help. That's something that you can do any time of year, and you could do it even outside of the American Rescue Plan and other years as well. If you decide you want to be taking less of your premium tax credit than the max amount, you can go on and change that at any time. It is the 15th of each month, though, is the deadline for it. In other words, if you do it now, between now and the end of next week, July 15th, it can take effect, be applied for your August bill. If you wait till after then, after July 16th, then you'd be looking at applying it to your September bill, and so forth. So you could call October 15th and apply it to your November bill. That's number two. And then number three, really probably a good segue to where we'll be going, is where August 15th is the relevant date for current members, is in terms of changing health plans. And that's a piece that normally you can only change health plans mid-year if you have a life event, like if you get married, or there's a whole set of life events. While the American Rescue Plan passing wasn't a life event per se in the normal sense for any of us, it did have a big impact on what health plans cost, and thereby has an impact on which meta level people may want to choose. And so that's what I think we'll get into, and that's something the current members have to do by August 15th. If they do it by July 15th, it can take effect. The new plan they choose can take effect August 1st. If they do it after July 15th, but before August 15th, it can take effect September 1st. But on that, if they call after or log in after August 15th, they won't have the ability to change plans. They'll have to either wait to open enrollment, do it for 2022, unless they have a different life event.
Great. Lot to consider and a lot of opportunity here. So we've got a couple of questions in the chat, and before we go to those, Sean, I know you and I have worked on this together some, but obviously there is a lot a lot of money on the table here and a lot of changes that folks may need to want to make. And this is a lot of information. So I don't know if you want to talk about, if someone's not comfortable just going online and making these changes themselves, what other options they have for making these changes or getting more information.
Yeah, absolutely. Happy to talk about that too. So, yeah, we've talked some about going online as one option to find materials, and we'll talk a little bit now about the plan comparison tool that people can find to get some help. But if you want some help either understanding that tool or just having somebody to talk to, there's a couple options. First, there's the customer support center, which is open from 8 to 4:30, Monday to Friday. And folks there would be happy to either help you make a change or talk through some of the options, explain how to use the plan comparison tool, explain what some of these terms mean. Another option is to go through our assisters. We have a network of assisters that work throughout the state and operating in all 14 counties. And if you go to the website, right at the bottom of the page, there's how to find help, and there's a link right to an assister network. There's a PDF there that has a link to phone numbers you can call, set up an appointment to talk to somebody in your area who can walk you through that. Like everything else in the state or in the world, I guess this year, used to be the assisters. We used to refer to them as in-person assisters. They mostly met with people, sat down in person with social distancing over the last year. I know they've been doing a lot of one-on-one work over the phone, maybe in some cases over over Zoom or Teams, and in many cases now with Vermont doing such a good job getting vaccinated, they're likely going back to having some in-person meetings, but also doing some conversations over the phone. That's gonna vary from from assister to assister, and actually you probably have a better handle on that than me, Zach. Are there any points about how people can get help from assisters that you want to underscore there?
No, I think I think that you highlighted the important pieces. I think a lot of people do find that meeting with someone one-on-one, whether it's over video or not through a call center or in person, like you mentioned, Sean, really gives them that kind of personal approach to their needs, and helps them make a more informed decision. Assisters won't rush you through the process. Not that the call center will, but as there's something nice about being face to face with someone and kind of putting your documents out on the table and being able to look at this, know you're looking at the same thing. I think that there's over 100 throughout the state, and they should be relatively easy to find. And if for some reason you aren't able to find an assister, I know you can contact the email address listed on the website, or the call center will actually help you find an assister if you call them. So just getting to a couple of these questions. Will the higher subsidies also apply to Vermont Health Connect premiums for all of the calendar year 2022? And is it possible the higher subsidies may extend into 2023 as well? Good question coming in.
Yeah, that's a great question. And yeah, so really, we didn't get as much into talking about a third benefit of the American Rescue Plan. We talked somewhat about, and you saw on the one graph, the only graph I'm going to share, how both people that didn't used to get financial help can now get financial help up to very, very high income levels. Number one. We talked about number two, how people who already were getting financial help can get a lot more financial help for pay lower premiums. And so those were two big components. Those components both stay throughout all of 2022, and the percentage of your income that you would have to pay, it will be the same in 2022 as it would be in 2021. So the actual gross premium, the full price of the premium will change as it does every year, but people who are getting financial help will largely be protected, and in many cases will likely find that they're paying even less in 2022 than they were in 2021 as a whole. And one thing I should underscore on that is that when I say what you're paying kind of overall for the year, for the average for the year will likely be what you pay overall for the year for the average in 2022. The difference will be, of course, in 2021 you were paying a higher amount for the first half of the year, 7 months of the year, depending on when you apply your new financial help, and then you'll have the opportunity to take even more financial help for those last few months of the year. So if you're taking your full financial help that you can get for 2021 in the last few months of the year, plus applying all that extra financial help that you would have gotten by virtue of paying more at the beginning of the year, then you could see a bump up, in your premium from December to January. But on average, you'll be paying about the same in 2022 as you did in 2021. The one distinction thing to call out, in addition to those two benefits, is the American Rescue Plan also gave extra financial help to people who qualified for unemployment insurance in 2021. And it doesn't matter whether you qualify for unemployment insurance now or not. If you qualified for at least 1 week at any point during 2021 and you meet the other requirements of getting tax credits, basically that you don't have another offer of health insurance, that you're not getting Medicaid or Medicare or employer sponsored insurance, then regardless of what your income is, you can get the maximum premium tax credits. Meaning on that graph where we showed, that couple would be getting that second lowest cost silver plan for $0 per month, and applying back past months means you could probably get any silver plan for close to $0 per month, number one. And then number two, you'll get very low out-of-pocket costs, which we'll talk about in a little bit. There are people who are at that income level qualify for cost sharing reductions, a benefit which comes as an enhanced silver plan. You don't have to do anything special. You just have to sign up for any silver plan, and you'll get a much lower deductible and a much lower maximum out of pocket and copays than you would in a regular silver plan, and in fact lower out of pocket costs than you would get in even a gold plan or a platinum plan. So people who in all types of unemployment insurance count, even the pandemic unemployment compensation, the pandemic unemployment assistance, as well as the traditional unemployment insurance. If anyone in the household qualified for 1 week or more this year, it means the whole household can get this benefit. So when we talk about changing plans, people who aren't in a silver plan but did have unemployment compensation should be very, very interested in changing to a silver plan sooner rather than later, at least for the duration of 2021. So I think, as this person asks, what's still around in 2022 and what's not, all of those income-based financial help in the same levels, those all carry into 2022, but the unemployment piece does not. So somebody who got unemployment compensation, very well, probably without exception, should want to move to a silver plan for the rest of this year, become open enrollment, maybe want to go back into whichever plan was right for your household based on your income for 2022. And then the other part of that question, is there a chance it could be extended? There is a chance. That's a piece that I know the federal government's looking at. I know Vermont's congressional delegation is very interested in making these changes permanent. And when the Biden administration put forth the American Rescue Plan, also had some other plans, the infrastructure plan we've heard a lot about, the American Families Plan as well. The American Families Plan called on making these first two provisions, I think not necessarily the unemployment piece, but the two that are for 2021 and 2022, extending them permanently. And that's something that's currently going through Congress. So it remains to be seen if that bill passes and what it looks like, if and when it passes. But there's certainly a chance that that these provisions could be extended. But under current law, we know they at least go through 2022.
Great. And I think that, just to summarize again, these are big changes in the health insurance world. Changes we haven't seen the likes of in a while. So big news and big opportunity here. Before we shift over to making plan changes, which I think a lot of viewers and attendees will want to know about. There is one question that I'm not sure if you can clarify, Sean. So to determine income eligibility for subsidies, the income is strictly earned income, Social Security benefits, and any unemployment benefits, correct?
Yeah, so that's a great question too, and I think to really get into the details of that, that's something that I think either calling up the customer support center or going online and answering the the questions in the application there, or sitting down with an assister is the best way to get precisely it. But in general, for the vast majority of people, the income is going to be very similar to what your adjusted gross income line is on your federal taxes. Officially, this is MAGI, so modified adjusted gross income, and the few modifications that are different from adjusted gross income are enumerated on the website, and folks on the phone can explain it too. But for most people, it's going to be exactly the same as their adjusted gross income.
Great, but yeah, I think that, just to reiterate what Sean just said, I think in my experience, whenever anyone has a specific question about what counts and what doesn't, it's really good to talk to someone or interact with someone at Vermont Health Connect or an assister to make sure that all of that stuff is clear for you. So just shifting gears to plans. So we've talked a lot about cost, but as Sean mentioned, there's an opportunity until August 15th to actually change your plan. Even if you don't have the usual special enrollment or a qualifying event, rather, that you might have in the past, there's kind of a new qualifying event because of the American Rescue Plan. And it allows us to be able to change our plans on Vermont Health Connect. So, Sean, can you talk a little bit about that window of opportunity and why someone might want to consider changing a plan now?
Yeah, absolutely. And I've alluded to a couple before, but yeah, we'll jump right into this. I think really when I look at choosing a plan, to probably three broad considerations can think about when you choose a plan. Number one, think about, as you reference, kind of choosing an insurance company. And when you talk to the Blue Cross and Blue Shield of Vermont and MVP Healthcare, typically looking into things like their their networks, the prescription drugs they cover, various other components. This, as I referenced before, however, for people who are current members, this consideration is probably one to save for open enrollment. And again, that piece to underscore is you can change to a different plan within the same insurance company, and your deductibles, anything you've paid towards your deductibles will carry over. But if you change to the other insurance company, your deductible will start over. So that's kind of, for this one, we're thinking at mid-year, the insurance company is probably less the factor or variable that many people will want to change. Number two is choosing a metal level. As current members will know, there's bronze, silver, gold, and platinum plans. All four metal levels cover exactly the same essential health benefits, the same covered services. So there's no difference in what's covered, and that makes it nice. So people don't have to think about, like in the old days, well, I have this condition, is that going to be covered? All plans, all metal levels will cover those same services, the same conditions. Really, it comes down to what people pay out of pocket. And our plan comparison tool, which people can find from the website, gets right at that. The third piece is choosing the plan design, and that's something that you'll hear the term standard plans versus non-standard plans, or deductible plans versus high deductible plans. And really, that's where it comes into play. When you use the plan comparison tool, you'll see an estimate of what your total costs will be based on your income and your health level. But really, for thinking about what a non-standard plan would offer, talking right to your insurance company would be a good way to find out more. If what they have in their non-standard plan, those special benefits, would really help you. And just to kind of at a bottom level, the standard plans are plan designs that have been specified by the state. So they'll have the same basic cost structure, same basic designs, copays, and so forth for a Blue Cross plan and for an MVP plan. For the non-standard plans, which for Blue Cross, that we refer to as preferred plans and select plans. And their preferred plans with Blue Cross include specialist and primary care visits at no cost to you before you pay your deductible. So for people who have a Blue Cross plan and expect to have a lot of primary care visits or visits with specialists, those preferred plans would really be something to look at. Their select plans can be paired with health savings accounts. So either if you have an employer that that doesn't offer insurance but does contribute toward a health savings account, and you want to pair that with a high deductible health plan or a consumer directed health plan, same thing there. They both pair with health savings accounts. Then you can look at some of those plans, both the standard plans and the select plans with Blue Cross that pair with health savings accounts. For the case of MVP, the plus plans, folks will find that they can earn up to $600 per contract per calendar year with well-being rewards, and they also have $0 virtual care with GS. So those are the types of things that you might want to talk to your insurance company about after you've taken that first step to maybe look on the plan comparison tool. I think from looking on a plan comparison tool, you'll see very quickly some of those folks we talked about. If you had unemployment compensation and you check off that box at the plan comparison tool, you'll see very quickly that the lowest costs in a good year, in a bad year, in an average year are going to be with a silver plan. For somebody like we showed here on the with that notice we showed at the beginning, somebody that was earning, a couple that was earning about $35,000, they would have an income that would be enough to get some cost sharing reductions, but not an enhanced Silver 94 or enhanced Silver 87 plan. They would actually qualify for an enhanced Silver 77 plan. So that's something that when you look on the When you look on the website there, you go into the plan comparison tool. You'll find that that clicking on the plan comparison tool, filling it out, and then when you go and you see what your financial help is going to be, and whether you qualify for cost sharing reductions. If you're seeing silver 87 or silver 94 there, your metal level selection just got really easy. That the silver is going to be have a lower cost no matter how much you need to use your insurance. No matter what the worst case scenario is, you're going to pay less in that silver plan than you would in a gold or platinum plan. If it doesn't say silver 94 or silver 87, if it says silver 77 or silver 73, or doesn't have a cost sharing reduction, that's when you'll really want to consider all the metal levels, and you might find yourself saving more money in a bronze or a gold or a platinum. And so that the plan comparison tool can really help you narrow down which plans seem like they might have the lowest cost, but then really diving into the plan and seeing some of those benefits in a plus plan for MVP or a preferred or select plan from Blue Cross, and talking to your insurance company to narrow it down further and get in the right plan can really be the way to go. So I think, like any type of research, if you put in a few minutes on a plan comparison tool, you're likely to save some money. If you put in even more time digging deeper on that plan, talking to an insurance company, talking to others, you can potentially save a lot more.
Yeah, and it sounds like the plan comparison tool is really a wonderful resource that combines all of these things into one place. So it kind of guides you through the questions, in my experience using it. And you can, depending on how you answer the questions, it's quote unquote a smart tool, right? So it will kind of adjust based on what you enter, and then kind of turn out the options for you that you can choose between. And then once you get to that page, you have all those options that Sean was talking about to filter by, so you can kind of choose what type of meadow plan you want, or what a good year, a bad year, an average year might look like for you to try and do some kind of rough financial estimation. So definitely think that plan comparison tool is a great place for people to start who have questions about this. We're running short on time, so I do want to talk about how we're going to continue to promote this information. And obviously, we're just touching the tip of the iceberg here with this ARPA health insurance changes in content. So we've got various mediums that we're trying to use to communicate this information. We will have more town hall meetings to discuss more specifics around the American Rescue Plan Act, ARPA changes. And Sean, you had mentioned a toolkit. Do you want to touch on that?
Yeah, absolutely. Happy to touch on that. And that, I think, would be mentioned at the beginning. There were three links on the homepage that I would highlight. So we talked about the login button, where you can go, to self-service, change the amount of money that you want to apply as a discount on your bill, financial help. You can also make your plan change right from there when you're logged in. Number two, we talked about the plan comparison tool, clicking on the shopping cart, going there. And the third one is that American Rescue Plan link. And if you click on that, you'll see a table here. And this table will talk about people who what it means to you if you got unemployment benefits, if you're directly enrolled through Blue Cross or MVP. Some of the other pieces we'll be talking about in the coming town halls, like people that have COBRA continuing insurance. But at the very bottom there in bold, you'll see I want to help spread the word about these new lower costs. And there's a link to an educational materials homepage. If you click on that link, you'll be able to see right to a toolkit, and that that toolkit will have things like a video, a educational video that people can see. There'll be some social media posts from Twitter. There'll be and Facebook. You can take some articles if you have a newsletter you want to add those. And let's see, what am I forgetting, Zach? I know.
No, I think you touched on the major.
Oh, the flyers, right?
Major mediums. Yeah, we also have the flyers, and I think that, basically we're trying to, reach out to the public as well to say, spread the word. This is good news for Vermonters. This is a big deal. So we are sharing as we can and doing these kinds of events, but we also are encouraging and really hoping that organizations and individuals alike continue to kind of spread the word and share. So we're trying to create that, that message and make it available on our website, and that will be updated as we go. So what is up there now is not set in stone. It'll grow, and we hope to organize it in a way that makes it easy to share and intuitive for users. The one other question, and we've only got a minute left, Sean, but someone asked the upcoming dates for the other town halls and the topics of those, and you touched to that, and I don't know if you want to kind of bring us out with that and wrap up the rest of our first town hall.
Yeah, absolutely, Zach, and it's a great question to end on. So thank you to the person who asked that. So the next one we're going to have is going to be 3 weeks from today, same exact time. So Wednesday, July 28th, from noon to 1. And the topic there, we really want to dig in. We mentioned a little bit about the folks that have had unemployment insurance and that compensation, and obviously any of you that are current members that are qualified for unemployment insurance, you would have already seen that in your notice you got last month about the extra financial help. We're also reaching out with our partners at Department of Labor to people that have gotten that benefit who might not have insurance. And so we really, as we move forward, really want to be reaching out to people that don't have health insurance. Vermont is one of the lowest uninsured rates in the country, and we want to continue to build off that because and want to get the word out to people that if they maybe looked a couple of years ago or even a few months ago and thought health insurance was too expensive, it's time to check again. And I think that's especially true for people that have gotten any unemployment compensation. So that's going to be a focus of the meeting on the 28th. Beyond that, we haven't nailed down all the dates or times. We expect this to go, throughout those other key dates we referenced right up to October 1st, the deadline for people to come in through the COVID special enrollment period. And we've referenced some of the other groups that can save money, but I think we also want to hear from everyone, right, Zach? I mean, if there's certain times they think would be best, or have questions or areas of focus, or want to get the word out to specific audiences, we want to be as accessible as we can. We want to partner with other organizations who might be able to connect us to Vermonters who will have questions about insurance. So let us know, and we'll schedule the rest accordingly. But mark July 28th on your calendar for now.
Yeah, that's absolutely right, Sean. Thanks. Well, thank you, Sean, for being our expert at our town hall meeting today. You will see us again on the 28th if you tune in, and just to let those know who maybe didn't catch the whole thing or want to share this town hall recording, we are going to do our best to try and post this online. So those who want to see the whole thing again or miss part of it are able to. So that is to come. And again, feel free to contact us, reach out if you have any suggestions or want to hear, or there's something you didn't hear today that you'd like to hear next time. And we'll look forward to seeing you then. Thanks.
All right. Thanks, everyone.